Acute myocardial infarction patients with a history of ischemic stroke have a poor disease prognosis. Previous studies have found that the risk of recurrent ischemic events remain high in this patient population, even when treated with clopidogrel plus aspirin. Ticagrelor is a potent P2Y12 inhibitor that offers a better platelet inhibition compared to clopidogrel. However, there is limited evidence regarding the effectiveness and safety of ticagrelor in this population. Hi, my name is Xinyi Huang. I am a postdoctoral research fellow in the School of Pharmacy at the National Taiwan University. I'm going to share the results of our study on behalf of our team. This article is titled as Ticagrelor versus clopidogrel in acute myocardial infarction patients with a history of ischemic stroke. The study will be appearing in an issue of Mayo Clinic Proceedings. My colleague and I conducted a population-based retrospective cohort study using a nationwide administrative claims data and found that in acute myocardial infarction patients with a history of acute ischemic stroke, the risk of cardiovascular events were comparable between ticagrelor and clopidogrel. However, ticagrelor was associated with a higher risk of intracranial hemorrhage, and it should be used cautiously in acute myocardial infarction patients with a history of ischemic stroke. This retrospective cohort study was conducted using the full population data of the Health and Welfare Database in Taiwan. We first identified patients at least 20 years old and were discharged with ticagrelor or clopidogrel plus aspirin following a first acute myocardial infarction hospitalization between 2013 and 2018. We then restricted the cohort to patients who had at least one hospitalization for ischemic stroke prior to the acute myocardial infarction. Patients were divided into two study groups, ticagrelor plus aspirin users and clopidogrel plus aspirin users, based on their first dual antiplatelet therapy prescribed after the index event. The inverse probability of treatment weighting was applied to balance covariance between the two study groups. We observed that ticagrelor use was associated with a significantly higher risk of intracranial hemorrhage compared to clopidogrel. However, there were no significant differences regarding the risk of clinical effectiveness outcomes and major gastrointestinal bleeding. From a clinical perspective, acute myocardial infarction patients with a history of ischemic stroke are often vulnerable to poor outcomes and high cost of care, necessitating meticulous clinical decision-making to maximize patients' outcomes. Results from our study suggest that the risk of subsequent ischemic events in ticagrelor plus aspirin are comparable to clopidogrel plus aspirin. However, ticagrelor should be prescribed with caution as it may increase the risk of intracranial hemorrhage. In conclusion, the risk of cardiovascular events were comparable between ticagrelor and clopidogrel among acute myocardial infarction patients with a history of ischemic stroke. However, ticagrelor use may increase the risk of intracranial hemorrhage in this patient population. The utilization of ticagrelor should be carefully monitored to maximize the effectiveness and safety of this dual antiplatelet therapy.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.